If you're doing billing in MyTherapyWizard, it's really easy to set up payers, and that includes insurance or non-insurance payment. So this is the insurance one, and you can see I already have a few down here. So if I wanted to add an insurer, I can search the ClaimMD catalog, or I can just start writing something in, such as Blue Cross. So you can see, like, if I wanted to add Anthem, I could select it. I could also choose a label for what I want to call that, because sometimes there's a similar payer code or an exact payer code but it is has a different insurance name. Anyway, if you know, you know. But you can create a label here, such as whatever it's called for you. And so let's just say that I would call that Anthem um, uh, teacher's plan or something like that. And then I can choose if I'm in network or not, any carrier codes. I can put notes here, and it's just as simple as that. Of course, on the back end, you'll need to make sure that you log into ClaimMD and make sure that you have signed up for eligibility claims or ERA. This basically says what is available for each one. So now you see I have a label of it. And then down here, I have my out-of-network ones. So let's go on to direct pay. So direct pay would be non-insurance. So that could include, contracts that you have, private pay, sliding scale, etc. And then we have a long list of CPT codes that you can decide to add depending on what disciplines you offer. So you can see here that here are some pretty common CPT or procedure codes here. And it also will assign a discipline to it, and then a type, such as you can see here. Oops, I guess I can make any changes here, but you can see the type. Oh, okay, so there is a type here that's called HCPS, I believe. But when you go through here, you can select the billing code. So you put in the code, what type of code it is. You can go ahead and put a description, which is here, what discipline it is, and then the default unit, like how that code is typically billed. And then that's how you add the code. You can also search here through the different disciplines and just see the list of those. On rates, you're kind of going to go and add this in this order, left to right. But for rates, once you have these procedure codes in, you will just go in and you can you select your insurance that it's for, since different rates apply to different insurers. This is the insurer payer code right here, and we will have another the label down here. So if you have two different insurances that have the same payer code, you can still separate it out by that label, like I said, like the teacher's health plan or whatever. So if you have default modifiers that you want always added to any claims, you can do that. And then down here again is where you will put in the rate and what the allowed is. And then if you have a fee schedule change or something like that, you can go ahead and do a from and an end date here. So that's what that looks like. So we have the non-procedure code. So again, that would be more of things that you're not going to bill to insurance, but you want to track. So I don't know, here are some different things that you may want to track: screening or a speech therapy screening for a PT or anything like that. Even if you had something like if you sold, some sort of like fidgets or things like that, you could put it there. And then lastly, we have the modifiers. So this would be where you would add any modifiers that you would typically use, and that way they'd be available to add to any of your procedure codes for easier billing, so that way they're not left off. That was the payer and procedure code setup.